How much do porcelain veneers cost in San Antonio? Most people probably think that porcelain veneers are only for celebrities or the ultra wealthy, those who are willing to drop $60,000 just for a new smile. But that's not always the case. My name is Dougherty. I've been a dentist for 16 years with a particular focus on cosmetic and comprehensive dentistry. At my practice, Dougherty Cosmetic Dentistry, I've helped many patients get the smile of their dreams, often for less money than you might think, sometimes achieving life-changing results for less than $10,000. But here's the real problem when it comes to veneers. If you don't understand how veneer pricing actually works, including the upfront fees, the lab costs, the design, you're either going to overpay, or worse, you're going to end up with fake-looking teeth that don't suit your face and will cost you more to fix later. In this video, I'm breaking down the real cost of porcelain veneers here in San Antonio. That's going to include the typical price ranges, what actually drives the cost, and how to find the right provider for your goals and budget. What are porcelain veneers? Before we get into all that, let's clear up exactly what we're talking about here. When most people hear the word porcelain veneers, they already have a bunch of things, assumptions that come to mind, and a lot of them aren't true. So let's bust a few of the most common myths. Myth number 1, aren't they fragile? That's what a lot of people think, but actually porcelain veneers are incredibly durable. When done right, they can be just as strong as your natural teeth. Myth number 2, do they need special care? Well, not really. If you already brush, floss, and see your dentist regularly, you're already doing everything you need to take care of veneers. Myth number 3, does it take forever to get them done? Not even close. The process is a lot smoother and faster than most people expect, and it usually only takes about 3 to 5 weeks to complete. Myth number 4, will people be able to tell I got veneers? Well, I mean, only if you tell them. A well-designed set should blend in so naturally, most people won't even notice that you've had any work done. But what are porcelain veneers, really? To put it simply, porcelain veneers are ultra-thin, custom-made shells that are placed on the front of your teeth. They're strong, they're natural-looking, and they're designed to last. But they're not just about looks. They can make your smile wider, straighter, and more symmetrical, but they also serve a protective and functional purpose, shielding your teeth from daily wear and tear, and in many cases, even preventing further damage. If we were to critically evaluate several of my most recent veneer cases, I would argue that in just about every case, the veneers we did improved the patient's function and made their bite better. But how do I know if I actually need veneers? And that's a great question, because while veneers are available to just about anyone, that doesn't mean they're the right solution for everyone. Here's a quick checklist to help you decide if this is the correct path for you. If any of these sound familiar, it might be worth having a chat with your dentist. Your teeth are slightly crooked or uneven. Maybe one tooth sticks out more than the others. Or your smile just looks a little off in photos. You've got small gaps between your teeth, especially in the front, the ones that you keep noticing in the mirror. Perhaps they bug you more than you'd care to admit. Maybe you have a chip or a crack in a tooth. Maybe it happened after biting into something hard or an accident, and now you find yourself holding back your smile just so you can hide it. You have deep stains that whitening can't fix. You've tried whitening strips, special toothpaste, maybe even some in-office treatments, but nothing seems to work. If your teeth look worn down or too short, this is common if you grind your teeth, especially at night. Over time, your smile can look flatter or less youthful than it used to. Maybe your teeth feel too small or out of proportion with your face. Sometimes it's not about damage, it's just that your smile doesn't feel quite right. Maybe your teeth look too short or spaced out for your facial features. So if any of this hits home, porcelain veneers might be your best solution. And if you don't know who to talk to, you can actually book a consultation with me. You'll get real answers, clear pricing, and most importantly, a personalized plan just for you. Click the link below to schedule your consult with me and take the first step to a better, brighter smile. Dental expertise. So all this is sounding right to you, and you want to take the next steps to getting this procedure done. But now, you're plagued with a question everybody probably asks themselves before they get any procedure done. Is it gonna be any good? Am I gonna look weird? Will I still look like me? We've all seen dental disasters, cosmetic surgery disasters, and no one wants any of this. So let me tell you what actually separates a great set of veneers from a poorly executed set. Not all veneers are created equal, and a big part of that comes down to who's doing the work. Not just the dentist, but the lab technicians making the veneers. If you've been calling around San Antonio and comparing prices, or if you've had multiple consultations already, you've probably noticed something. The numbers are all over the place. Some dental practices quote way lower than others, and at first, that might seem like a good thing. But the truth is, you kind of get what you pay for. But when it comes to veneers, it's not just about the material. It's about the skill, the training, and the eye of the dentist doing the work, as well as the skill of the dental lab technician and the ability of the entire team to communicate with each other about desired goals. Let me put it this way. Imagine for a moment we're talking about getting a haircut. Technically, any salon or barbershop can give you a haircut. But if you really care about the shape, the style, any intricate details, you probably want someone who understands texture, balance, and what works best for you, right? Well, the same idea here, sort of. The biggest difference here, though, is that with a haircut, if they get it wrong or there's a miscommunication, it isn't the end of the world, your hair grows back, right? When it comes to having your teeth done, the stakes are a little bit higher. Things won't fix themselves if you get it wrong. So anyway, back to dentistry. Two dentists might both offer porcelain veneers at completely different price points, but the results could be totally different. And that's why expertise matters a lot. An expert cosmetic dentist doesn't just glue veneers onto a tooth. They're designing your veneers based on your face shape, skin tone, lip movement, and even how you talk or laugh. Some people say it's an art and a science. Honestly, I find the whole cosmetic dentist or artist thing a bit of a stretch. I consider myself a craftsman. I'm not trying to be creative or express myself when designing a smile or a dental treatment sequence. I'm adhering to principles of aesthetics and design that I know will work. When done correctly, veneers can be amazing. You'll leave the dental office with a brand new smile that's completely natural and comfortable. But let's be honest, not every dentist who offers veneers is going to give you the results you want. It requires skills and workflows that not every dental office is set up to execute. If you're trying to figure out how to find the right cosmetic dentist in San Antonio, here's a quick 3-step checklist to help. Step 1, check their credentials. See if the dentist you're considering seeing has taken extra courses in veneers or smile design. This is a plus, which leads us to step 2. Look for memberships in professional organizations. If the dentist you're considering is a member of the American Academy of Cosmetic Dentistry, or in any kind of study club like a Spear or Seattle Study Club, these are all good signs. It means that they're staying up to date with the latest tools, trends, and techniques to give you the best results possible. For step 3, evaluate the services they offer. So the next thing you need to do is check what kind of services they offer, because not every cosmetic dentist does the same kind of work, or at least not at the same level. So before you even start to search, ask yourself, does this practice I'm considering going to focus on cosmetics? Or does it seem like they do it all? That's why it's a good idea to look for dentists offering a wide range of cosmetic options. It's a green flag if the practice highlights cosmetic dental treatments like veneers, clear aligners, tooth whitening. It's kind of a red flag if they seem to do everything, like pediatric dentistry, big discounts, or use the term one-stop shop. You want a dentist who can handle comprehensive and cosmetic dental treatments instead of a practice that doesn't seem to have a clear focus on what they offer. And this next part is important. Step 4, check the results of real patients. Once you've given some consideration to the services you want to learn more about, don't be afraid to ask the dentist how often they do these procedures and what's the typical patient experience like. Even better, ask to see some before and after photos of past patients who've had similar issues to yours. Because believe me, it's one thing for a dentist to say, yeah, I do that procedure. It's another thing to actually see the kind of work they've done. So let's talk about the number of teeth. So here's the thing, not everyone needs a full set of veneers to get a stunning smile. A lot of people assume it's all or nothing, but in reality, it's different for every person. Sometimes just 2 veneers placed in the right spot can fix a small imperfection and totally upgrade your teeth. Other times, you might need to do 4 or 8 to create a more cohesive look. Sometimes there's no way around it. You gotta treat 20 or more teeth to get the desired results. It really depends on what we're working with and what we're aiming for. But here's what most people don't realize. You can't and shouldn't decide the number of veneers on your own. You need a proper consultation to figure that out because several factors play into this decision. First up, your smile goals. What are you hoping to change about your teeth? Do you simply want to fix a chipped tooth or go for a complete smile makeover? Next is your tooth symmetry and aesthetics. Because even if you only have one problem tooth, treating that alone can sometimes make things look a little off. So if you want your teeth to match, not just in shape and size, but in color and spacing too, we've got to look at your case comprehensively. And speaking of your natural teeth, we also have to keep in mind their condition. Some teeth may not need veneers at all. They might just need to be whitened or some small adjustments. But if a tooth is worn down, cracked, or heavily stained, a veneer can add strength, protection, and make it look better. Finally, there's the budget. Let's be real, veneers are a big investment of time and money. And while the results can be amazing, most people want to make sure they're spending wisely. Doing 2 to 4 teeth will obviously cost less than doing your full upper or lower arch. And for a complete smile makeover, you could be looking at anywhere from $20,000 to $70,000, depending on how many teeth you're treating and the complexity of the case. So how do you actually figure out how many veneers you need? There's no simple answer to this question. Every patient's case is completely different and unique to them. While it depends on several factors, here's a slightly oversimplified, step-by-step approach that I use when I'm trying to decide how many veneers I need to use to make a patient look great. Originally, I wanted to come up with a list of things that you could do at home, a self-assessment of sorts, so that you might have some idea about how many veneers you need. But I'm convinced it just can't be done. I don't even think I could figure it out on the street. If somebody showed me their teeth, I'd need some records. Step 1. Start with a smile check with photos and videos. My assistants usually take a photo of a patient smiling and sometimes a really exaggerated smile too, from several different angles. We also do some digital scans. And the first thing we have to decide is this a ready-to-go veneer case? Will veneers alone fix all of our problems? If the edges of the teeth are really in the wrong place, and if there's severe crowding, and if the gums are in the wrong place or very asymmetrical, these are problems we have to address before we place any finishing touches like veneers. So for the purpose of our discussion, let's just pretend that we're all good to go on that front. And that brings us to step 2, which is how many teeth does the patient show in an exaggerated smile photo? Any teeth that show and don't look good, well, we have to at least treat those, right? That's your starting point, because those visible teeth are the ones that need the most attention. Then we got step 3, where things get a little complicated. Will this case look better and function better if we raise the bite? Lots of veneer cases just won't work, or they won't look right unless we treat all of the teeth on one or both of the arches. For great looks and great function, changing the way the bite comes together can make or break a case. This is something that's difficult for most dentists to understand, let alone patients, and it's a decision best made with all of the proper dental records at hand. Step 4, create a phased plan. Here's where we figure out exactly what we're going to do and how to make everything work. We've got the dental needs, we've got the patient's desires, we've got the patient's budget, the patient's timeline, and of course that which is physically possible and comes with an outcome that's desirable to the patient. Balancing all of these things is the most difficult part. Sometimes there's compromises that can be made at this stage that are acceptable. Sometimes it's all or nothing. Every situation is completely different, and pretending that it isn't is kind of dishonest. So let's kind of clear the air here. Do veneers in San Antonio really cost $70,000? Or is that just an exaggeration? You've probably heard people throw that number around like it's some kind of standard. But by now, you probably already know it's not that simple. The cost of veneers depends on a lot of things, some of which we've already talked about in this video. And really, you're not just paying for a set of porcelain teeth. You're paying for the full experience, and every detail matters. You're paying for who you get to be every day after that, with a confident, healthy smile. From the planning, the materials, the precision of the lab work, to the dentist's skill and aesthetic judgment. It all plays a role in how natural your smile will look after and how long it will last. Think of it like getting a custom suit for a special event. Sure, you could walk into a store, grab something off the rack, and call it a day. Yeah, it might even fit okay. But when you're investing in something important, something that's gonna change your life, you want more than just okay, right? You'd want something that's made for you, with incredible intention, meticulous attention to details. So that's why at Dougherty Cosmetic Dentistry, we charge $1,700 a tooth for porcelain veneers. And that already includes everything from start to finish, like the design and smile planning, the custom lab work, the temporary veneers, the final placement, and even the fine tuning afterwards, just to make sure everything feels right. There's no hidden fees or surprise charges, just an all-inclusive price per tooth. And when it comes to the process, here's what you can expect when you get porcelain veneers at Dougherty Cosmetic Dentistry. Step 1 is the initial consultation. This is where everything starts. We'll sit down with you, we'll listen closely to your smile goals, and talk through everything you're hoping to achieve. During your session, we'll also go over examples and show you before and after photos. From there, we can discuss further what you like and what you don't like. But of course, as I said, every case is unique, and nothing beats actually seeing what those changes could look like on your teeth. Which brings us to step 2, designing the mock-up. Based on our discussion, we'll add some temporary material to your teeth. Sometimes I'll do it freehand, and other times we'll design it with the lab together. And this just helps give you a real-time preview of what your new smile could look like. Because we don't like surprises. There's always a chance you'll love it, or you might hate it. So instead of taking chances, we always work with a blueprint that you're happy with. In doing so, we can ensure that the results are something that you'll love. And once we agree on a design, we move on to step 3, which is the tooth preparation. We'll prepare your teeth following the exact mock-up plan. And depending on the condition of your teeth, we may need to remove a tiny bit of enamel. This might take a few hours. After everything's set, we can go to step 4, which is digital impressions and temporary veneers. We'll send the digital impressions to our lab technician so they can make your final veneers. veneers. In the meantime, you'll wear temporary veneers that we will custom make during our appointment based off of our plans. You might be wondering, why not just go straight to installing permanent veneers? Well, the answer is simple. We want you to have a feel of the actual thing before making it final. So while we handcraft your permanent set, you'll test out your temporary teeth first and see how that feels while going about your daily routines. This will help you adjust to the new change and see whether you're happy with the results. These of course won't be exactly like your final veneers, but they typically give us enough information to dial in a few important details. If you have any complaints or concerns, we can address those before bonding the finals. And once you're happy with it, we proceed to step 5, which is the final bonding. Here's where we check every detail and see if they feel comfortable in your mouth. If they're good to go, we'll bond them in place with precision and care. Typically, we'll do at least one follow-up appointment to fine-tune your bite and give you a custom mouth guard. And that's it. So with proper care, this should last you anywhere from 10 to 15 years. I'll tell you that I have several cases out there in the wild that are more than 10 years old, and they're still going strong. So with proper care, they may last even longer. So if you're still curious about how it all comes together, I've broken down the entire veneer process step by step in a simple guide, so you know exactly what to expect before, during, and after treatment. Check out this next video to get the detailed blueprint for a perfect smile.